Good morning, everyone. I'm going to talk a little bit about the people we work with at Frontier College, and we're a literacy organization. The people we serve are people who are the most vulnerable because of their lack of literacy skills and because of their geographic location. So we like to think we serve the hard to serve. So if you're in a remote community where you don't read or write very well, we are where you might go to get some help. And this is going to sound like I'm anti-technology, and I'm not. I just think my challenge, if I run out of time, I'll put my challenge out there in the beginning, is when we're thinking about technology and we're thinking about it being the great connector and the great democracy builder, we need to think more inclusively about those people who aren't accessing that technology. Because I think our inspiration to have people connected is to have their voices lifted, to hear them, to have them not be so isolated. But in fact, what's happening is technology is becoming so prevalent, it's actually becoming a barrier for those who are most at risk or most isolated. So as we're developing these things, I want you to consider those people. One of the things I want to bring up is around the assumption that the world is connected, that everyone has access. We work in about 60 First Nations communities across Canada, and the broadband is getting better, and fiber optics is getting better, but in many of those communities, there's only one computer. Perhaps it's in the band office, perhaps it's in the school. So thousands of young people, First Nations people, aren't having access to that technology. They want to, and it's important to them, but they don't physically have access to it. Secondarily, there is a movement to get more computers into those communities, but they haven't thought ahead about it. So we know those communities have low literacy levels. We know that people are struggling with education in those communities, and so people think, well, let's send them up computers. That'd be great. But there's nobody in those communities to fix those computers. So when my computer breaks down, I pick up the phone, I dial 3112, somebody comes, plugs in my computer, turns it on, gives it a smack, fixes it up. In First Nations communities, there's no one to fix those computers. Nobody knows how. They haven't built that into the system of having computers. So there's this graveyard of dead computers in the north that nobody knows how to fix. And if they did know how to fix them, we also have to worry about how they get those parts in, because it's hard to in flying communities just to get that hardware up there. I also want to talk about some of the people we deal with day in and day out and give some of their stories and how as we develop technologies to better serve our organizations or better serve ourselves, that is leaving people behind. One of the women I like to talk about was a housekeeper in a hotel. And so she cleaned rooms. She had been doing that for many years. She was quite good at it. Wasn't with a big hotel chain. She worked casually. She didn't have benefits. She had small children. So one of her friends said, you know, I work for a big hotel chain, and they're looking for people. So you've got experience. You should apply. You'll get a job for sure. And she's like, great, because it was unionized, and it was better pay, and she got benefits, and that was important to her. So her friend said, all you have to do is go online and apply. All you have to do is go online and apply. She couldn't. She might have had access. She's in inner city Toronto. She would have access to a computer, libraries, community centers. The accessibility wasn't her issue. Is that she didn't have the basic reading and writing skills to manage that technology, and she didn't have the computer literacy skills. So she didn't get that job. So we have to think about that when we're thinking that people are connecting and that we're getting. She could do the job, but she couldn't actually get the job. And so we need to worry about her. And I also worry about her. You see some prescription medication stuff around there. She's got small kids. One of the reasons she wanted benefits was to care for her kids. You know, this winter I've had cold after cough, et cetera, and so I'm constantly managing between cough suppressants and cough expectorants and decongestants and Advil or Tylenol, and I do a nice self-medication concoction to help me sleep at night. And if I'm worried about taking one or not the other, if I can't read or figure it out from the information on the bottle, I can go online. Well, I worry about that woman whose 5-year-old kid is coughing and coughing and coughing and coughing all night. And she doesn't know whether she already gave him cough medicine, whether there was too much cough medicine, whether she can give them more cough medicine. And when we think about health and more health information being put online, I worry about those people who are trying to manage their simple illnesses or their long-term diseases because of their basic reading and writing skills are lacking. We also worry about people, we talk a lot of the federal and provincial policies around literacy and essential skills being developed in the workplace, because we know most people who have trouble reading or writing are actually employed. And I think that's good. But again, with a lot of the work being done in workplaces, there's the assumption that people can go online or they can read or write. So I just want you to think about the people who've been maybe working on a manufacturing line, and there's a new piece of technology, and they need to figure it out, and they've been there for 10 or 15 years, and their boss says, "Did you read the manual? You get how this works?" He goes, "Yeah, for sure, I get how this works." He's like, "Great." But the reality is, he hasn't, and he's not about to tell his boss he can't read or write well enough to read it, because he might lose his job, and that makes him vulnerable. So the concern needs to be, what if that machine breaks down and it's going to chop off someone's hand and he doesn't know how to stop it from working? Or how about those hospitals where we hear a lot in the CBC, I think it's CBC is doing the segment on healthcare and hospitals. I think it's Marketplace, worrying about whether hospitals are clean. The people who clean the hospitals are probably low skilled and perhaps have reading and writing issues. So are they reading the health and safety protocols well enough? Have they go online and read that new health and safety hand washing memo? Perhaps they haven't been able to have the reading and writing skills to do that. So we need to think, as we think that's the great equalizer, we realize that people won't confess that they don't read or write well enough, and that makes sense. And we also know people don't know what they don't know. And we're doing some research with the Institute for Competitiveness and Prosperity here in Toronto, looking at older workers who are out of work. So perhaps they've been working in the auto industry, they've been laid off, the government wants to retrain them, they're having a hard time being retrained, they're not entering their programs, these programs aren't being successful. So because my filter is literacy, I think, is it that they don't want to go back to school? Is it that they're lazy? Or is it that perhaps they graduated with grade 12 or maybe grade 10, and maybe they were reading at that level, or maybe they weren't. But after 10 or 15 years, reading and writing skills, you lose them, just like driving. If you haven't driven a car in 15 or 20 years, you're probably not the best person to get behind the wheel. So we're doing some research around part of the barriers to those people entering the retraining, the people that we're really worried about now because they're a whole vulnerable sector of society, aren't being able to be re-educated because they don't have reading and writing skills. And because they haven't been reading and writing, they actually don't know that they don't read or write very well. So to take online courses, to take distance courses, to upskill themselves to go into the workforce is difficult for them. And we need to worry about them. I know technology is the answer because we see the young people coming into our programs using technology, and it's important to them. And they all come with these phones, they all want to be on the computer, and they're embraced in this technology. And so we have to kind of figure out how we use it better to teach them, to integrate them, to get them motivated to learn. And how I know technology is the secret is a story about one of the young people we work with. We have what we call is the level 1 class. It's literacy we kind of evaluate on 5 levels. Level 1 is the lowest level of learning, and level 5 is, the highest level. And you're all probably in this room somewhere between 3 and 4, and that's great. So these kids come, and it'll be shocking to you, they're between 24 and 18, and they're at level 1. And there's a whole bunch of reasons why society and schools have failed them, and we'll talk about that at another time. But we had a funder come in and talk to these kids. And they all went around and said, what they were getting out of this class. And it was the usual stuff. I mean, a lot of the kids talked about, it was the first time that anybody didn't make them feel stupid, that they really reevaluated their goals and really saw that they could do something more, that they decided that they wanted to go back to school or that they wanted to get a different kind of job, and they really believed they could do that. And then this one young man, very cool, handsome young man the funder said, well, what do you get out of it? And he's like, yeah, a lot of girls text me, and so now I don't have to give my phone to my sister to read all those texts. So that resonated with me, and I don't want to leave you on the note that sex and technology are going to be the great technology builders. Perhaps they will be, and I'm okay with that. I mean, I think whatever gets the reluctant reader reading is fine with me. I think of it that any kind of text is the gateway drug to the classics, so I'm happy if they use that. But it really said to me that people want to embrace technology, but we're just not thinking about them. And as you go in this afternoon talking about building citizenry and engaging society, you really have to think about those people who are becoming far more isolated because of the assumptions we make about technology being everywhere and that people actually have the basic reading and writing skills to navigate those technologies. So have that filter as you're creating, have that filter as you're trying to include those people, and if we really want to empower those who are most vulnerable to have a say in society, we really have to recognize the barriers that these new technologies are providing for them and figure out how those new technologies will begin to include them. Thank you.